NuCell. We are a new company here in Narberth, and our focus is on healing people without surgery. We're actually using your own body cells to heal yourself. My name's Alan Taylor. I'm a board certified physician assistant for 20 years. I went to Hahnemann University and then I went to Yale University. We can do a multitude of procedures with stem cell therapy. Stem cell therapy is a process by which we use your own stem cells. So you might ask, what's a stem cell? A stem cell is a cell in the body that can turn into any other type of cell. So how does a stem cell do this? It does it through messaging through proteins. And so that might sound a little complicated, and it is, but the bottom line is a stem cell can grow into any other type of cell. So why do we need stem cells, Alan? We need stem cells so that you can replace your skin every 3 or 4 days. That's right, your skin sheds just like a snake every 3 or 4 days. So the cells that are on the skin that turn into skin cells are originally stem cells. When we eat steak or lobster or something that goes in our mouth and we chew on it, it rubs the enamel away in our teeth. And so we constantly have to replace our enamel. There's stem cells in our teeth that turns into enamel. Whenever our eyes secrete fluid, that fluid has to have stem cells, and there are stem cells that turn into that fluid. So the bottom line is a stem cell is a cell that can turn into any other cell. We use that science to help you regenerate. We draw the stem cells up, whether it be from your blood, which is called PRP, or we take it from your adipose tissue or your fat cells in your belly, or we take it from your pelvis, it's bone marrow. All three sources are stem cells. We then spin those stem cells in a centrifuge, which is a very specialized machine that spins the cells at a much higher rate than a normal centrifuge. And then we draw those stem cells up and inject them into the area of concern. So whether that be a hip or a knee or the skin of your face, or even for hair restoration, wherever we inject it, it will help that area to regenerate. I've not read one article in the medical literature reporting any type of problem with stem cell therapy. I myself have never had a complication or had anybody have a complication in the 20 years that I've been practicing. And so I can safely say, yes, stem cell therapy is safe and it is effective. And I'm happy to say that I have developed a technique that is absolutely painless. I'm the only practitioner that I know in the country that injects people the way that I inject them. I take certain steps. The steps that I take slowly numb the area that I'm going to inject. And so before I even inject a patient, they're already numb before I even touch them. So it is not painful. In most people, it's one injection. Most people. However, here at NuCell, we realize that everybody is different, and so we create a customizable schedule. If a person or if a patient needs an additional injection, they're able to get one, and we can switch back and forth between the different types of stem cells, meaning we might start with a PRP and then transfer to an adipose tissue, or sometimes we just start with an adipose tissue and transfer to a bone marrow. So we've got lots of options in terms of how many procedures to do, but mostly it's one procedure and done. This procedure, for the most part, is not covered by insurance. About 98% it's not covered by insurance. I think that in the future it will be covered, but right now it's not covered. It is an out-of-pocket expense. Physical therapist. Here at NuCell, we have our own physical therapist, and our physical therapist is a doctor of physical therapy, and his name is Paul, and he is specifically trained to regenerate people after their procedure. And so each patient gets a customized treatment plan, and it works out for their benefit. And he's very well trained in treating all types of sports injuries, work-related injuries, and he does a great job, and it's right here in-house. Have a toothache like pain after the procedure. That lasts for about 24 hours. After that, for the first week, you don't really see a lot of improvement. Then about 2 to 3 weeks later, all of a sudden you start noticing gradual improvement. 4 weeks out, you notice markedly improvement. And about 5 weeks out, you notice stunning improvement. That's for most people. And that's working with physical therapy. There is no downtime. Patients can go back to work. The only thing that we ask them to do is to not exert themselves in a strenuous manner. We say it's fine to resume your activities of daily living, but don't go out and run a marathon. Our protocol is we ask patients to call us when they come to our parking lot, and we have signs where they can park in the parking lot, marked NuCell, and they call us or text us and tell us that they're here. We bring them up in our private elevator, and they are brought right into a sanitized room. And the room is cleaned and sanitized after every patient. So we are COVID compliant, we have a protocol that's personalized attention just for the individual patient. Anytime you pierce the skin, there's a chance of an infection. However, here at NuCell, we use a betadine alcohol solution that cleanses the skin of all bacteria that lives on the skin, and all of our materials are sterilized, and every procedure is done under sterile technique. Our lab personnel are trained to treat the PRP and the stem cells under sterile conditions, and they have years and years of experience as well. So here at NuCell, we can do a multitude of procedures with stem cell therapy. And I'll just start at the top and we'll work our way down. So we have the ability to inject the scalp for hair restoration. We draw your blood or harvest your stem cells from your abdomen or your pelvis. We then spin those stem cells and re-inject them into your scalp. In about 4 to 6 weeks, patients notice hair growth, and it works very well. The next procedure that we do is a cosmetic procedure where we inject stem cells into the face, and generally the patients look about 10 years younger. It takes care of wrinkles, it takes care of rabbit's feet that sometimes get into the eyes. It makes the skin look rejuvenated and refreshed, and it's a wonderful procedure. The next stem cell procedure that we use, or that we perform, is a breast lift, and that's where we inject stem cells into the medial side of the breast, and that pulls all of the breast tissue together to give a cleavage type look, and it pulls the breast up as well. We also are able to inject bones, joints, tendons, ligaments, and muscles for any type of injury, whether it be a work-related injury or a sports injury or a motor vehicle injury. We have the ability to inject those structures, those musculoskeletal structures, with stem cells, and that helps people to heal. So for men that have erectile dysfunction, we have the ability to do something with stem cells where we inject the stem cells into the penis. And for women who have decreased orgasms, we have the ability to inject stem cells into the vagina, and it rejuvenates the nerves and the blood supply of the vagina. And most women have said that their orgasms increase by 10 to 20-fold after the procedure. We use IV stem cells and nebulized stem cells. The IV stem cells help the inner linings of the lungs and make you feel younger and stronger and give you more energy. And lastly, we can give a nebulized stem cell that goes into the lungs to help the lungs to regenerate as well. That works well in patients that have COPD or other respiratory problems. And lastly, we have the ability to inject stem cells for women who have urinary incontinence. So women who have had children or even are older and have urinary incontinence, maybe they cough or they laugh and a little bit of urine comes out. With one procedure, we have the ability to stop that. One procedure where you can receive an IV drip for a multitude of conditions. One of the conditions is for micronutrient vitamin deficiencies. And so we have the ability to draw your blood and send your blood to a specialized lab, and that specialized lab will check to see what your selenium level is, your zinc level is, different micronutrients that are needed for the immune system. It's important because here at NuCell, we have the ability to boost your immune system and give you all the advantage you need to beat any type of illness that may come, and that includes the COVID virus. We also have the ability to give you IV fluids. If you've already had COVID and you're still having symptoms, we have an IV fluid that we can use to make you feel back to yourself and much better. We have the ability to give you IV fluids for hydration, and hydration makes your kidneys work better, makes your brain work better, increases your blood pressure, and generally helps you to flush out pathogens. Along the lines of pathogens, we have the ability to give you high-dose vitamin C, and that increases the acidity in the blood. That makes viruses and bacteria not be able to survive in the blood. So our IV fluids here are done by a phlebotomist, and it's a very comfortable room. The room is cleaned and sterilized after every patient. We also have the ability to allow you to use your iPhone or iPad or computer. There's desks set up next to each chair, and there's power to the chair, to the desks, so you can recharge, regenerate, and reboot here at NuCell. Thank you.